Welcome to H&HN Daily. I'm Senior Editor Bob Kehoe. In January 2013, the Centers for Medicare and Medicaid Innovation provided 460 healthcare organizations the opportunity to participate in a bundled payment pilot. To discuss this latest development and what steps are needed to effectively integrate post-acute care settings into the care continuum within a risk-based environment are Jade Gong, Senior Vice President, and Brian Fuller, Senior Consultant with Health Dimensions Group. Welcome, Jade and Brian.
Thank you.
So, Jade, where are we today on bundled payment initiatives in healthcare?
Well, bundled payment is not a new concept, and bundled payment has long been recognized by CMS and OMB and others as a payment model that could bend that proverbial cost curve. What is new and was exciting to us was when CMMI announced the pilots that it created several opportunities for post-acute care to be involved in the bundle. Of the 460 entities that you mentioned were participating, almost 80% of those awardees are including post-acute care in this pilot. So why post-acute care? Well, for patients that receive post-acute care services, the spend on acute care is about equal to post-acute care. And so that is where the real opportunity lies, to drive some value to the healthcare system.
Brian, what opportunities does bundled payment offer to better manage the post-acute care setting?
We see the key opportunity is to redesign care across the hospital and post-acute continuum from the patient's perspective. So think about a COPD patient today. They go into the hospital. Their care is then overseen by one or multiple physicians. They may need rehabilitation or home health services. So to us, they bounce in and out of what we consider acute and post-acute care. However, to the patient, it's just care. So redesigning a system and creating incentives that reward maximum outcomes and improved patient experience on lower a cost and more efficient care delivery is something that ultimately is best for the patients, and we think that's a great thing.
Jade, how significant are the savings opportunities in this area when we look at the post-acute care setting?
Well, we looked at that obviously very closely with our clients that consider their participation in this pilot. And for the awardees, they had to promise CMS somewhere between 2 and 3% of reduction in spending. And this is derived in three principal ways. First of all, providers have to pay attention to the first setting of discharge. So where do they put that patient first? And is that the setting that's most cost effective? Should that be an LTAC or a SNF or a home health setting? Secondly, because we are having bundled payment, we are guided by an evidence-based care pathway. So we're continually making sure that the patient is placed in the best setting for them that produces quality outcomes at the lowest cost. And lastly, all the providers are paying attention to reducing hospital readmissions whenever possible. Having said all of that, for the post-acute care side, we think for some of our clients and for some conditions, it is possible to achieve savings in the range of 20 to 40% on the post-acute care spending.
And Brian, what are the keys to success for hospitals that want to pursue this avenue and look at the post-acute care setting?
Well, you have to remember hospitals long have not placed a high degree of value in post-acute settings and their ability to manage patients across the continuum. So one of the first keys to success is for each to understand the other side and to be able to talk each other's language and understand where the roles begin and effectively end and try to smooth off those handoffs as much as possible. Second key to success is data, and that was one of the benefits of participation in CMMI's pilot is you got an inordinate amount of Medicare data where you were able to analyze utilization patterns, care pathways, patient costs, and understand what the source and the opportunity was over a period of time, whether that was 30, 60, or 90 days. Finally, this key success factor that we see a lot of movement on currently is the mentality of a collaborator and the development of a partnership network that includes the hospital at the core, but also post-acute providers, most notably skilled nursing facilities and home health agencies. So those systems that can effectively function together, understand where the opportunities are together, and play appropriate roles along the continuum we think are the keys to success.
And Jade, where are we headed from here with bundled payment? We've seen some earlier initiatives by CMMI, and where do you see things going?
Well, first of all, as I mentioned earlier, the bundled payment pilot is about to start, hopefully in October of this year. So there are not findings yet. So while we don't have a crystal ball, it's clear that fee-for-service payment systems will disappear, and they will be replaced over time with hospitals, health systems, and others working together to manage the care of populations. We firmly believe that bundled payment is really quite doable and a really great next step for hospitals with their partners, SNFs, home health agencies, and others to take care of specific patients around specific conditions where acute and post-acute care providers can come together and improve the care that's delivered to these populations.
I would add a couple of points too. There are now some real policy statements that are being made about the gaining momentum of bundled payment. For example, in the president's budget, there now is a defined goal that at least 50% of the post-acute spend be under a bundled payment type of mechanism by the year 2020. So from a policy perspective, both at the presidential level and at the MedPAC level, we're seeing the momentum and the outlook gain over time. The second thing is we're seeing is commercial payers following suit. So in rapid succession in states across the country, we see commercial payers implementing bundled payment arrangements with a variety of networks that include perhaps just post-acute or hospitals and post-acute providers.
Thanks, Brian and Jade, for joining us today on H&HN Daily.
Thank you for having us.
Thanks.